Moving around with no pain in your daily life is not possible without your healthy knees. Your knees are able to cushion your movements and help support your weights with no excuses. But over time, your joints may undergo a wear and tear condition. You may experience stiffness in your joints after sitting for long periods or after waking up from bed in the morning. So what do we seek to stop this pain? We wanted an instant relief. We get painkillers and anti-inflammatory medications at our nearby pharmacy. But is that really the best solution for the long term? If you have been suffering from knee pain for a long time, the right action is we should seek a professional's consultations and proper treatment from orthopedics to help us free from the pain. Hi everyone, I'm Jackson, the registered pharmacist of Joshua Welling's Pharmacy Group. As you watch, knee pain is a nightmare, especially for most elderly people. Are you or your loved one affected by this knee pain? If yes, kindly follow us with our Watch My Knee info series affiliated with Pantai Hospital Penang and 𝗢𝗦𝗧𝗘𝗢𝗢. In this first episode, we are going to share with you on what is osteoarthritis. In this series, Mr. 𝗢𝗡𝗙𝗙𝗙𝗢, consultant orthopedics and traumatology surgeon from Pantai Hospital Penang, will be educating and sharing with us more about knee pain and osteoarthritis, or called as OA. With his 13 years of experience in orthopedic and traumatology department, he has encountered and consulted many patients with OA conditions. Let's listen to what Mr. Boon says about OA.
I always tell my patient, osteoarthritis is actually not a disease, but a natural process. It's part of our life. So every one of us will experience it either sooner or later. So first of all, if you want to understand what osteoarthritis, you have to look at the normal knee. Okay, this is normal knee. Okay, in the normal knee, we always have this cartilage or we call soft bone to cover on the bone. This is femur bone and this tibia bone. Both bone surface is covered by this cartilage. It's very smooth, shiny, and no defect or no hole. In between these two cartilage, there's always meniscus or gel to prevent these two surfaces to knocking each other. So when you are young, you can do whatever you want without any pain at your knee. However, when you use it more, then this gel or this meniscus will become thinner and thinner, and sooner or later, this cartilage is actually rubbing the other cartilage, and this will cause a small defect. This one is the defect on the cartilage, and this defect will stimulate inflammation. So in this early stage of osteoarthritis, patient will feel that the knee is swollen, is warm, and is painful. If things is not done correctly, then the process will progress earlier or faster, and sooner or later, all this cartilage is distracted. You can see there's no more white shiny surface already in the late stage of osteoarthritis. So at this stage, the bone is actually knocking each other and causing even more deformity. Patient will experience very severe pain, and sometimes they're not able to walk or even stand in this stage. There's two types of knee osteoarthritis, the primary and the secondary. So for the primary knee osteoarthritis, it means that a natural process, wear and tear process of the disease. Means that if you use the knee more, then the meniscus of the gel exhausted more, the cartilage will have an early destruction or degenerative. This is called primary. It's a natural. While for the second group, secondary knee osteoarthritis, this type is actually an abnormal group. Means that there's abnormal reason to cause early degeneration of the knee cartilage. Example, injury to the knee. For those who have accident to the knee, or some sport injury or ligament injury to the knee, they may experience early onset of knee osteoarthritis. Another disease is some inflammatory joint disease or even some infection to the knee may cause abnormal destruction of the cartilage as well. This is the causes of knee osteoarthritis. So who is the person who has the risk to have osteoarthritis? First, those sport person or those who are very active in sport, especially those like hiking, they may have early onset of degeneration of the knee cartilage. Second type is, especially in our population, those who like to squat down, they actually have the risk to have this early onset of the knee cartilage degeneration. These are the person who has a higher risk to get a knee osteoarthritis.
Hi everyone, I hope that Mr. Boon sharing about what OA is gives us a better insight on osteoarthritis condition. Stay tuned with us on our upcoming episodes at Georgetown Pharmacy and Wellings Pharmacy Facebook page, which we are going to share on symptoms of OA and how knee OA is diagnosed. Last but not least, we are having a referral program affiliated with Pantai Hospital Penang with a complimentary X-ray scan at Pantai Hospital. If you need more information on this, check out the caption. See you!